You always
it.
like to start off with our
I do.
current numbers.
Well, you know that I am the former CFO of Quia Delta, so you can never drift too far away from the numbers.
Right.
No, I do like giving folks some context and actually some improving news to share today. So that's very good. So again, I'll start at the state level. So this was as of yesterday. The state has reported just shy of 59,000 total cases statewide, of which a little more than 3,300 required hospitalization. About a third of those were hospitalized into the ICU. And unfortunately, we've had a little bit more than 2,400 deaths at the statewide level. Bringing that down to the county level, and the county actually posts this daily on their website. So of the state's 59,000 positive cases, Tulare County has had 916 of them. Unfortunately, you've seen just the last few days we've had some significant spikes. Earlier this week, the county reported out 101 positive cases, which is the single highest day since the outbreak was first saw in Tulare County. And there's some reasons behind that, which I'll touch on in just a moment here. So 916 positive cases at the county level, 150 have reported recovered. So those 916, obviously all the way back to the beginning of March, of those that tested positive, of those 916, 150 now have fully recovered, no longer with any symptoms, and the county knows that because they continue to monitor and constantly stay in touch with those 916 patients. We've had 41 deaths throughout Tulare County over this time period. Tulare County has now conducted more than 4,000 tests, of which almost all of them were specimens that were collected by Quia Delta. So we've actually collected, as of yesterday, 3,900 specimens that have been largely tested by the county, but as I mentioned a few weeks ago, we started having the ability to test in-house. So Quia Delta is very much involved in the county testing. And the county is observing a positive rate of about 17%. So of those 4,000 plus tests that they performed, roughly 17% of them have tested positive. And I don't know exactly how that rate compares to other places throughout the state. Interestingly, and this is, I think, the news of the days recently, is no doubt about it, and this is a national observation, is that nursing homes are being hit particularly hard by this virus. In fact, the 41 deaths that we've had in Tulare County, all of them have occurred in people that are older than 65 years old. And so obviously our nursing homes are a very vulnerable population, elderly, a lot of times with underlying health conditions. So of those 916 positive cases in Tulare County, 358 of them are associated with nursing homes. So literally 40% of all the positive reports are nursing home patients. Redwood Springs, obviously the most noteworthy of all the nursing homes, still standing out as having the single largest nursing home breakout of any nursing home throughout California. So 205 cases at Redwood Springs. Lindsay Gardens just announced they're up to 99 positive residents and employees. Dinuba Healthcare, 22 positive cases. Sierra Valley, 20 cases. And Linwood Meadows, only 12 cases. And I really want to applaud Linwood Meadows. Our staff and leaders have been very involved in working with them, and I think they've just done an outstanding job, not only responding to the outbreak in their facility and exercising all the appropriate isolation and use of PPE, but I think they were definitely more prepared. And I tell folks often, is it better to go first or better to go last with anything in life? And I think very unfortunate for New York that they really were the ones that went first from just really being overwhelmed. But we got to learn a lot from them in California. Just watching what was occurring in those hospitals, what was occurring in other places like New Jersey and Louisiana, I think we took a lot of those lessons to heart, and I think that's why California has done so much better than New York. And same with the nursing homes. Redwood Springs was definitely where it broke out first, but the other nursing homes in the county were able to watch that very carefully and acted as quick as they can. So that's been very positive. Reese Foods, unfortunately, as we talked about, I think it was last week, they now, as of yesterday, had 107 of their employees that have tested positive. I believe they closed their plant temporarily in Dinuba. I'm not certain about Tulare, but between the two plants, they had 1,300 employees. So it's highly likely that we'll continue to see additional Reese Foods employees that are going to be testing positive. But the 101 cases that we saw just a couple days ago that the county announced, that was almost entirely attributable to the continued breakouts we're seeing in nursing homes and then the Reese Foods breakout. In terms of what's happening more locally here at Cahuilla Delta, again, I mentioned that we've collected 3,900 specimens since the 1st of March. 391 of them were positive. 124 or 32% of them are people that are younger than 30 years old. So while younger people might fare better in fighting the virus, successfully fighting the virus and avoiding hospitalization, they have not proven to be more immune or less susceptible to contracting the virus, which is what is most disconcerting to us, is young people contract it, maybe feel entirely asymptomatic or something very mild, but still are highly contagious and can spread it to older folks that don't have the same ability to fight it successfully. So since the beginning, we have now had 104 admissions to our hospital that were COVID positive. So again, we get back the 916 positive cases throughout the county. 104 of them required hospitalization and were admitted to Cahuilla Delta. The good news that I referenced earlier is that we only have today 20 COVID positive patients that are in the hospital. So we definitely have hit that plateau and may actually be coming down the slope in terms of hospitalization, ICU admission, intubation. We are seeing steady declines in those rates, and that's a very positive thing. Of the 20 that are in-house right now, only 2 of them are in the ICU and are intubated. And we have had a number of patients that had been in the ICU and successfully beat the virus and were discharged home. So we love celebrating when a patient successfully overcomes the virus and is able to return back home. Only 1 of those 20 patients are on what we call the Broderick Pavilion, which is an intermediate critical care unit. So really only 3 of the 20 are in that more critical condition. The other 17 are on 2 South, which is our dedicated respiratory unit. And of the 20 patients that are in-house right now, 17 of them are from nursing homes. So the vast majority of all the hospitalizations that we've been experiencing over this time period really have been coming from the nursing homes. And if it wasn't for the nursing home breakouts that we've seen here, I think you'd see Tulare County would actually have done pretty well, pretty low compared to the rest of the country or the rest of the state. And then lastly, thank you for always being concerned about our employees, those heroes that are putting themselves on the front lines every day. We have had, of our 5,000 employees, we have 38 of them that have tested positive. They all but a couple were sent home, quarantined. We did have a couple employees that did require hospitalization. All of them have gone home except for 1 who still remains hospitalized. We've had no new cases among employees since last Friday. So that's, again, a very positive thing. Of those 38 that tested positive, 10 have already come back to work completely without symptoms and have tested negative. We only bring employees back when we're confident that they're no longer contagious and not exhibiting symptoms. And we have 18 more of those employees that now have successfully beat the virus, that are now symptom-free, and they're anxious to get back to work, and we're anxious to have them back to work. So that's a recap of where we are at the state, county, and local
Okay,
level.
perfect.